We'll have another presentation by Dr. Melissa Pinnock Williams. You have a fan base? All right. You see the fans? No ask no question. You see who no know can ask too. All right. Melissa and everybody. Thank you.
All right. Good afternoon, colleagues, distinguished guests. This afternoon, I'll be sharing with you on supplementation for a better you. I thought about this presentation because we have a lot of supplements that are on our market, and we have patients who have free access to some of these things. Some of our patients that are taking supplements, of course, are on prescription medication, and these are not without clinical consequence. So what exactly are supplements? And I know we know. Supplements pretty much are anything that enhance or complete something. So for this presentation, we're looking at dietary supplement. And when sometimes we think about supplements, the first things that come to mind are our micronutrients. So we think about our vitamins, we think about our minerals. But included too in this category are our enzymes, our amino acids, and our herbs. And these have drug interactions, and it can affect our clinical outcomes in our patients. There are several factors, though, that may cause a patient or an individual to want to supplement. And one of the most predominant factors is our improper diet. And I say our because I'm included in that group. I know that we have those among us who really are sticking to that balanced diet, but sometimes our lifestyle does not allow us to have the right types of food in the correct proportion, and as such we have a deficit. And in order to compensate, we must fill that gap through supplementation. Now you'll see coin to this is exercise. Now we have those acute events that may come up. It could be the wedding we're trying to fit into that gown. It could be the summer body that we're working towards for our beach events. And this causes us to make drastic changes in our diet in order for us to shed those excess pounds. Now what you find is that most of the time the changes include lots of fruits, lots of vegetables. These vegetables sometimes are our green leafy vegetables. And of concern particularly are those patients that are on long-term anticoagulation therapy. So green leafy vegetables we know are rich in vitamin K. So imagine that patient too who is supplementing with a multivitamin that also has vitamin K. Then what it means is that it has implication for the patient coagulation therapy. Disease and medication pretty much goes hand in hand. A ready example that comes to mind is our diabetic patients who are on long-term use of metformin. And the truth be told, patients who are on metformin should be supplemented with vitamin B12. And oftentimes we do not get the opportunity to advise our patients, and our patients may not be aware of this. Age is another important factor because as we age, our nutritional requirements changes. So what a baby would require is different from what an adolescent would need and for an elderly patient as well. And if we take females, for example, we know that when we reach menstrual period, we need to increase our iron or vitamin B12 and folic acid to prevent anemia. When we get older postmenopausal, then that iron requirement is no longer as what it would be during our younger years. And cultural and social practices too has implications. We have those vegans who are strictly vegetarian. They don't have any other sort of protein apart from plants. And what we see, especially for those of us who practice in hospital settings, we will find whereby we have some of these patients coming for cobalamin injection, vitamin B12 deficits. So there's room to counsel these patients to say you must supplement in order to prevent this deficit. Now, some of the benefits that are to be had from supplementation include the prevention of disease, and this goes without saying. If you're not nourished properly, then you will suffer from deficiency diseases. Prevention of burnout. Adjunct to medical therapy. So sometimes we're treating patients with conventional therapy, but they do need supplements in order to augment or enhance that clinical outcome. And we're looking at a simple example again, anemia, whereby separate and apart from whatsoever other pharmacotherapy alternatives we give, supplementations with iron does help, vitamin C does help with the absorption of iron, so we look at little things like these. And overall to maintain vitality and health. Now, there are certain population of patients or customers that are among us that we must pay key attention to. And of note, I would like to specifically point out our patients who suffer from chronic disease, especially those with multiple comorbidities. Patients with multiple comorbidities, what it means for them is that they have several pharmacotherapeutic agents that they're taking, and as a result, their risk for drug interaction increases. Much less to add supplements to that, we're further complicating the issue, and as such, we must take these patients into consideration. Age difference, geriatric, pediatric patients, patients with poor overall health, and of course, our pregnant women. What is important about this presentation is the fact that we have what we call our drug supplement interaction, and it takes place basically in two forms. We're looking at our pharmacokinetic interactions. So these interactions now results from when the nutrient affects the absorption, the metabolism, the distribution, and elimination of the drug molecule. And the common enzyme that is usually involved is the cytochrome P450, which we know most of our conventional therapy go through that pathway. We also have our pharmacodynamic interaction, and this often takes place now when the nutrient either behaves similar to the conventional medicine or it antagonizes it. High doses of vitamin A and vitamin E will increase anticoagulation effect of warfarin. Vitamin K will decrease the anticoagulation effect of warfarin, just an example. So this is a case example of how drug supplement interaction occur. So there was this 76-year-old Caucasian patient who was on conventional therapy for multiple comorbid condition. Tumeric is one of those supplements that are out there in the field now that boast a lot of clinical advantages, and we know what these advantages are. However, what they recognized in this patient after doing blood chemistry was that the patient's liver enzymes were increasing. They could not find out what was now happening with this patient. This patient has been on her medication. She has never had this issue before. But luckily, this patient was well-read, so she thought, you know, I've started my turmeric. Let me do some extensive reading to see if this could be a possibility for me. And upon doing her research, she found that there was some implication for autoimmune hepatitis induced by turmeric. So she discontinued for 2 months, went back, did a blood chemistry, and they recognized that the liver enzymes were now decreasing. And post a year after discontinuing this treatment, she recognized that her liver enzymes returned to normal. So sometimes when we have our ambulatory patients coming into us and we're thinking that the therapy is not working, sometimes it is these supplements that they're adding to their treatment that is causing a problem, and we ought to keep an eye out for that. Reports from the Drug-Induced Liver Injury Network 2014, and I thought to point it out, is showing that they did a study between 2004 to 2013, and when they follow these patients, they recognize that liver injury increased from 7% to 20% due to herbal dietary supplement interaction, So this is a real problem, and we are seeing it here. So they recognize too that bodybuilding, HDS caused prolonged jaundice in young men who were doing bodybuilding, and the remaining herbal dietary supplementation caused cases presented as hepatocellular injury predominantly in middle-aged women, and we're looking at death and transplantation. And the statistics are there, we're seeing that it is significant. So tips when recommending a supplement for ourselves, for our patients. Sex. And this is something I always battle with. Does it make a difference, the nutrient male take versus female? And what research has shown me is that it does make a difference. And then it made sense when I saw the facts. So females at certain stage may require a higher content for iron, vitamin B12, and folic acid. If we give the same concentration to males, they may have cardiac involvement. Right? So we ought to look out for that. Lycopene, too, is an antioxidant that is included in male multivitamin. And what that does is to help to prevent prostate cancer in this group of patients. Age, and that goes without saying, we spoke about that already. And just to pause here a minute, medication history, current meds are things that we ought to look at when we're recommending supplements to our patient. And from the OTC line, one that is very common, and I'm sure all of us have the experience of customers being on oral contraceptives. I never knew before the research. What I found was that customers who are on long-term oral contraceptives, and they regarded long-term as up to 6-month consistent OCPs, they recognize that they have a deficit of niacin, folic acid, iron, B1, and B2. And they are also associating that deficit with the increased obesity among patients who are on OCPs. So that is something we need to know. Let our young ladies become aware of. Listen, if you're on long-term OCP, then you need to be on a multivitamin, or at least your diet has to be adequate. And diet goes without saying. Social history, for those of us who needs to remain stimulated throughout the day, so we on the caffeine, especially us female. Caffeine decalcifies the bone, and there is room for study to look at the relationship between coffee and osteoporosis later. So these patients definitely need to be on the calcium and vitamin D, of course. And I'll leave you with this, because there's no absolute one nutrient that is safe. So safety is a complex issue determined by considering the combination of likelihood and consequence. Cari-Med takes care of you from pregnancy, birth to old age. We have our VitaBiotics line, which is extensive with our multivitamins. We have Diabeon, specific to our diabetic patients. One a day, we have both men and women. And of course, our kids, the Flintstone line. Those are my references. And a surprise quiz. You should be getting these, thank you. You should be getting the questions to these shortly. So once you were paying attention, it means you have a prize to win. So check your smartphones and send in the answers. Those are the questions. If you have not received the questions, you will be getting them shortly. So answer as quickly as possible. There is a prize to be won. And I thank you so much for your attention.